As far as going back to the CHIP program, what people find benefits them the most people sign up for CHIP because they're having issues with being overweight and have some form of heart disease or diabetes. So we have patients who start out with diabetes who are on insulin or just on oral hypoglycemics like metformin, oral medication, and they find that they very quickly can cut back on their medication. We have a few patients whose insulin needs drop to zero and they're not on insulin anymore. We have patients who were taking oral hypoglycemics like metformin and don't need to take it anymore. We also have patients who are pre-diabetic or diabetic and were about to go on medication, and because they went on the CHIP program and learned how to eat properly, they were no longer diabetic and didn't have to go on the medication. So that's one thing. The other thing is we have patients who have heart disease, may have angina, or may have something called claudication, which is pain in the leg when you try to go walk for any particular distance and your leg starts to hurt, it cramps up because you're not getting enough blood down there. So we find that a number of those patients who are trying to accomplish those things, they do accomplish those things, but then interestingly they come back and say, I never thought of it, but I was trying to get my blood sugar and cholesterol down, which I did successfully, but now I'm sleeping better at night, my insomnia is gone, my heartburn is gone, I'm not taking Prilosec anymore. And so for that reason, it's been really quite remarkable. Yeah.
And what is the success rate of the CHIP program compared to other medical interventions?
Wow, that's a great question. So the question is, what is the success rate of the CHIP program compared to other medical interventions? Well, let's take an example of, say, heart disease and coronary artery bypass. So basically, when somebody has a coronary artery bypass, it's because they're having severe angina, which is restricting their activities and making their life unbearable. And for that reason, they have surgery. So how much longer can somebody who has coronary artery bypass expect to live? Basically not at all. There's really no extension of lifespan for having that. There may be some improvement in symptoms, as one would expect. One of the most important things about coronary artery bypass is it gets people out of their normal routine, and they start going to, after the surgery, they go to rehab, and they look down and they say, wow, I got this big scar here. That was a big deal. I guess I better start taking care of myself. Well, it seems like not the best way to get people to start taking care of themselves. So CHIP, in contradistinction, has people taking care of themselves without surgery and without drugs, and actually it treats the disease. It doesn't just treat the immediate problem. Now, treating the disease is really what's key here. Treating the cause is what we call it. And if arteries are closing down, wouldn't it be better to change things so that the arteries stop closing down and in fact start to open up? That would be a much better than having every time an artery closes down going in and reopening it. It's a little bit like repaving a road. I guess I've never made this analogy before, but it's a little bit like repaving a road all the time instead of like just changing how we use the road and taking better care of it. So you want to keep your vessels open. You don't want to have to keep reopening them with angioplasty or with balloons. So that's an example of, I think, where CHIP is better than the standard medical treatment. Of course, the same thing is true for diabetes. If people can lose weight, then oftentimes their diabetes goes away. Wouldn't that be much better? I mean, right now we're headed for this incredible epidemic of diabetes. We're expected that 1/3 to 1/2 the population will be diabetic in the year 2050. Well, that's just crazy. How will we ever take care of all those people? There won't be enough healthy people to take care of them. And yet, if we just did the simple lifestyle measures of eating properly and exercising a little bit, we could avoid all that.